Next company is a dental improvement through AI company, but the lead entrepreneur, Max, is part of our 99 Tartans team. And I don't know if any of you know about 99 Tartans, but it's a great way for you all to participate in the growth of CMU companies. 99 Tartans is CMU alumni investing in CMU founders. It's a very low bar of entry. There's no fees to join the group. It's all free. If you want to invest in a company, the minimum is $5,000 if we can get an aggregate of $100,000 into a deal. We've done deals up to $1 million. So if you are a CMU alumni or a friend of CMU, you can participate in this group. And many of the companies that have come through the McGinnis Venture Competition have gone on to raise 99 Tartans money and institutional capital as well. So if you're interested in that, please see me at the reception tonight, and we'll talk to you then. Without further ado, Max, take it away.
Can you hear me? Okay, that's perfect. Hi, I'm Jacinto, a math and AI major with experience at a Y Combinator healthcare startup.
I'm Anshika, a product innovation grad with 4 years of experience designing AI and ML products.
And I'm Max, an MBA student at CMU and a board-certified dentist. Dentistry is a $150 billion industry, yet the foundation of our patient care remains inconsistent, inefficient, and outdated. After helping grow my brother's clinics, expanding dental businesses for a private equity firm, and performing over 630 procedures, I've seen the flaws in a dentist's workflow from every angle. Your dentist's typical workflow should follow 4 steps. First, diagnosing your issue, creating a treatment plan, explaining it back to you, and then executing it. But I've seen firsthand that steps 2 and 3 are where many of the pain points occur.
But why?
Well, creating and communicating a plan can be extremely time-consuming and costly. First, to create a plan, dentists have to sift through thousands of research papers to find the best evidence for each patient. Then, they're stuck navigating clunky software, taking over 15 clicks to log one treatment option. Second, explaining the plan well to the patient can take a lot of time. Clinics actually report that explaining plans can take up to 30 minutes per patient, costing over $1 million annually in lost opportunity.
But why should we care about this?
Well, dentists often rely on personal judgment instead of research-backed plans, leading to unstandardized, biased, and outdated treatments. I've personally been asked by even seasoned dentists to remove perfectly healthy teeth due to poor planning, which can cause permanent bone loss and chronic disease. They also frequently fail to explain treatment options clearly, despite legal requirements to do so. My brother, also a dentist, actually got in trouble for spending extra time explaining plans to patients.
Whereas for patients, they fall victim to overtreatment and malpractice. Also, many of them agree to treatments they don't fully understand, often unaware of alternatives. Serving over 50 patients, 40% reported receiving no information before treatment.
And for insurers, the CEOs of Highmark and United Concordia told us that excessive reimbursement waste is a major pain point.
So, what did we do?
Enter PlanWise. First, we enhanced dental decision-making through AI that automates research and plan creation, making the process more scientific and much faster. We also iteratively refine recommendations based on dentist feedback. Second, we increase patient awareness by sharing the plan with them and also solving all of their queries through a specialized AI agent. So here's how it works. Say Amin is our patient. With his medical history, current diagnosis, and access to a vast amount of research and guidelines, we generate one full treatment plan with just one click.
We don't replace dentist judgment, we enhance it. In fact, each recommendation is traceable back to its clinical evidence, giving dentists full control and visibility into their treatment plans.
And from the patient side, Amin receives his personalized plan, where he can have all of his questions answered through a specialized agent. So we go beyond a productivity tool for dentists. Patients get better dental care and are more informed in the process, and insurers see a reimbursement waste reduction.
To tangibly measure success outcomes, we'll track metrics such as planning time, case acceptance rates, and net promoter score. As for competitors, Overjet and Pearl excel in diagnostics but don't offer treatment planning. Traditional EHRs offer planning, but they are manual and tedious. Show and Tell communicates plans but does not generate them. We fill that void.
We primarily target large dental organizations, also called DSOs. These seek consistent care across their clinics, as they mainly employ neurodentists who have less advanced treatment planning skills. In fact, following recommendation from United Concordia's CEO, we actually pitched to 1,000+ clinic DSO who expressed interest in a $2.4 million annual contract.
Our early adopters will be small clinics who've tested our first MVP. They're eager to adopt PlanWise between 10 to 18K per year at a 2 to 3 month sales cycle. They believe in our value so much that they've already committed $100,000 in LOIs.
These commitments signal strong market demand. We're here because we believe that every patient should leave a dental chair with confidence, knowing that their treatment was backed by the best science and not just guesswork. Thank you.
Thank you.
So when the smaller dentist offices, have plans backed by science, not guesswork, what's the ROI to them ultimately?
So dental clinics primarily generate revenue by spending time seeing patients, right? You saw earlier that the process behind generating an evidence-backed plan is extremely tedious and lengthy. As a consequence, dentists actually skip out on that process entirely, and this can lead to overtreatment. And when you overtreat, the consequences is then you have to bring the patient back in to do a corrective procedure, usually at no cost to the patient. Does that answer your question?
How often does that happen?
So it happens all the time. For
10%?
I'd say more than that. If I had a ballpark and estimate, I'd say probably about 80% of the time. As an anecdote, my girlfriend, my friends as well, who've gone to dental clinics were overtreated for issues that they never had to begin with. I myself have been asked to remove perfectly healthy teeth or drill into perfectly healthy teeth due to poor planning.
Is this unique to the dental industry?
No, so in the medical industry, there are competitors such as Open Evidence that actually draw on available research online and aggregates that data to guide clinical decision making. When you, as a patient, go to different providers, you're often going to hear different plans being offered to you rather than a different diagnosis. So in other words, you receive the same diagnosis, but the plan to address that diagnosis is different, right? And so in the medical space, you have those providers that provide that summarized research to guide those decisions. In the dental space, that's what we're doing as well.
So when you provide that plan, is AI generating what's the best plan, or does the dentist have the final say? Because that really matters in terms of FDA approval requirement.
Absolutely, absolutely. So our AI, what it does, it generates the treatment plan, and then the dentist has all the power to modify it in case it was incorrect, and then they have the final say, yes.
Dental work is a very hands-on business, and as you get experience, you really know what you're looking at pretty quickly. It's a little bit different than medical diagnoses, I think. Yeah. What's to say there's the long-term need for this tool?
So regarding actually creating an evidence-backed plan, the complexities come, like even as you gain more experience, the complexities come in seeing more advanced patient cases. Those are your high dollar value procedures. The US population is aging faster and it's getting younger, and as a consequence, they present with more complex treatment needs. Secondly, with that, what helps keep our product an integral part of a dentist workflow, which I think is essentially what you're getting at, right, is once you know what the treatment should look like, you know how far apart each of these treatments should be scheduled, you know what the treatment notes should look like, which are legally required, and you know the insurance codes associated with each treatment option. So by expanding the functionality, which we intend on doing, we become an increasingly integral part of a dentist workflow and help address inefficiencies in multiple areas.
You used the example of you being asked to drill into a healthy tooth. Mm-hmm. I'm missing something. Can you explain how PlanWise would prevent that from happening? What data is being looked at, and how is that intervention occurring?
Right. So there are two components to that. The first is the diagnosis, right? There's already AI software out there, as Anshika has mentioned, that addresses that part. So let's assume that part's good. The second part to planning on what to do with that healthy tooth is with regards to your actual treatment plan. So some of the issues I've experienced having worked in clinics is that part of the planning process is really ambiguous. It's reliant on personal judgment, as I mentioned, rather than research. So given a certain diagnosis, given a certain patient profile, how should you address that, right?
Is there any feedback loop on outcomes to
Yeah.
compare results to these plans?
Absolutely. So actually, perhaps complementing Max's response, one of the good things about providing a treatment plan is that we can see the modifications that the dentists have done. That helps us improve the model. But it also could be, for example, something that insurance companies could see and see like, oh, maybe there's a pattern. They always modify this procedure in these treatment plans. What is going on here? So it could also provide a way to see so that, the procedure that Max was saying to be incorrect and to be flagged by an insurance company.
The AI explain why it's selected a certain plan?
Absolutely. Yeah, absolutely.
Okay. A great question for the networking event, right?